Questions. Do you feel bad after eating certain foods? Do you get abdominal discomfort, bloating, flatulence, burping? Are you constipated or alternate loose stools with constipation? Do you have any allergies to food? Or simply have you been treated frequently with antibiotics before? It is very possible that you might have a condition called leaky gut syndrome. What is leaky gut syndrome? Leaky gut is an inflammation of the inner lining of the small intestine. These are the cells that are specialized in absorbing the food. We will review a little bit what happens normally when we swallow food. When the food is mixed with saliva, the carbohydrates are digested. After that, the food will go to the stomach where it mixes with the gastric acid. This part will take care of the proteins of the food. And finally, the food will pass to the first portion of the small intestine. In this case, it will mix with bile from the liver and with some ferments coming from the pancreas. The state of the food at this moment is just in the form of a liquid and will go to the next portions of the small intestine. In this part, the food will be absorbed and will be later transformed into muscles, bones, or simply energy. So the cells of the inner lining of the small intestine are able to recognize good from bad in the food. When the substances are good, will be rapidly absorbed. When they are bad, they will be rejected and they will be eliminated in the large intestine. On the other hand, there are some people that has been frequently treated with antibiotics that produces an imbalance of the bacteria we have in the large bowel. We have good bacteria which will help in absorption of vitamins and minerals and will protect your inner lining, or we have the other bacteria that needs to be eliminated. The person with leaky gut syndrome is most likely someone that has been eating processed food, fast food, treated with antibiotics, that is under stress, or a combination of all of these factors. All these factors will produce an inflammation of the cells in the inner part of the small intestine, so the absorption is totally impaired. Under these conditions, an inflamed intestine will lose its capacity to select what is good for you, and many toxins will be recycled inside of the bloodstream. The chronic inflammation of the cells of the small intestine constitute what is called the leaky gut syndrome, and constitute all the symptoms that we were talking before. As an example, many people suffer from joint stiffness and pain, lower back pain, muscle pain, and fatigue. These symptoms are produced in absence of any trauma, and it's because the inflammatory conditions that start with the food and the excessive absorption of the toxins make the liver very insufficient sometimes to detoxify the body. These substances will produce a reaction in your immune system, and then the immune system will start producing substances that will produce inflammation in your muscles, in your bones, in your joints in general. So how to know if you have leaky gut? First of all, check what is your daily diet. If you eat fast food, you're an emotional eater, you feel numbness or itching or skin spots, it's possible that you might have this problem. People with leaky gut frequently report abdominal discomfort, bloating, excess of gas, and loose stools alternating with constipation. Solutions for this problem is consume organic food. Avoid bread, pizza, pasta, starch. This food contain gluten, which is a significant factor for inflammation of the intestine. Avoid dairy products. Increase fruits and vegetables in your diet. Take probiotics, which are good bacteria, especially the ones that have been treated with antibiotics before. Use olive oil in a raw form, just in salads. Cook with coconut oil and with avocado oil. Try to avoid artificial sweeteners. Use honeybee, agave, or brown sugar in moderation. The intestinal cells we have been talking about are exchanged every 3 to 7 days. If you follow these instructions for approximately 2 weeks, you will see a very significant difference. I hope this will help you.